Hello, and thank you for participating in our research project. This presentation is brought to you by a group of second-year physician assistant students at Harding University. In this video, we are going to be discussing childhood vaccines, their safety and the research behind them, and common myths associated with vaccines. What are vaccines and how do they work? Vaccines stimulate your body's natural defenses by teaching your immune system to recognize and defend against harmful germs. After receiving a vaccine, your body is then prepared to fight off a disease faster and more effectively in the future. At the bottom of this slide, you'll notice a visual explaining how this process works. A vaccine is a weakened or inactive form of a virus or bacteria that cause disease. After receiving a vaccine, your immune system creates antibodies. These antibodies have memory, so if you are exposed to the virus or bacteria in the future, the antibodies recognize it and fight the disease, often before you even experience symptoms. Vaccines protect your child from many diseases that are listed here. Some of the more well-known ones include cervical cancer, diphtheria, Ebola, hepatitis B, measles, meningitis, polio, whooping cough, pneumonia, chickenpox, and tetanus.
Vaccine safety testing. All vaccines go through extensive safety testing, including multiple clinical trials, before they are approved for the public. During this testing, immune responses, optimal doses, and common side effects are analyzed. The vaccines are continually refined to promote maximum benefit and minimal risk. Data from all trials are submitted to regulatory agencies like the FDA, the EMA, or WHO. Only after revision and approval, the vaccines are released for public use. Here we'll be discussing common myths and what the research shows about them. Myth number 1. Vaccines contain harmful ingredients. Myth. Concerns about ingredients like thimerosal, a mercury-containing preservative, or aluminum have led some parents to believe vaccines are toxic. Fact. The majority of vaccine components are naturally occurring in the body, in the environment, or in food. Thimerosal was removed from most vaccines many years ago despite no evidence of harm. Its use was safe in small quantities. Aluminum in vaccines is minimal and much lower than the amount we are exposed to in everyday life.
That brings us to myth number 2, that vaccines cause autism. In 1998, Dr. Wakefield published a study that revealed a possible link between the measles, mumps, rubella vaccine and autism. This has had lasting effects and has caused many parents to become terrified of vaccinating their children. However, this study was found to be both fraudulent and unethical as Dr. Wakefield falsified facts for his own financial gain. The study was retracted and Dr. Wakefield lost his license to practice medicine. Since then, more than a dozen studies have taken place over the last 25 years involving large populations, none of which have been able to find any evidence that links vaccines and autism. While rates of autism have increased over the last several years, this is due to better diagnostics and more acceptance, not vaccines.
Myth number 3. Vaccines completely prevent infection. Myth. Many people believe that it is impossible to get sick after receiving a vaccine. Therefore, if someone gets sick after being vaccinated, they often assume the vaccine was ineffective. Fact. Vaccines do not prevent infection, but rather help the body learn how to defend itself against disease when it becomes infected in the future. It is still possible to get sick after being vaccinated, however, the immune system is able to respond quicker and the body's response is much less severe, preventing the need for hospitalization.
Our last myth is that it is better to obtain immunity by having the disease than through vaccination. Many people believe that having the disease and acquiring natural immunity is both a more thorough and real form of immunity than through receiving a vaccine. However, while natural infection does provide immunity, the risks of severe complications from the disease itself are significant. These include hospitalization, disability, and even death. In addition, your child is more likely to pass on the disease to someone else, putting them at risk of complications. With that being said, many people ask, what if my child is young and healthy and are unlikely to experience these complications from disease? Well, the effects of disease are unpredictable and no one is guaranteed not to experience these complications. Vaccines provide immunity without these dangerous consequences and are therefore both a safe and effective method of acquiring immunity. So, are childhood vaccines safe? No medical intervention is 100% safe or effective on an entire population. Everything has some form of risk involved. For example, even something as simple and commonly used as Tylenol has a risk of liver damage. Vaccine effectiveness depends on several factors that I have listed here, a few of which include the vaccine itself, age, medical conditions, genetics, etc. Therefore, how well a vaccine works varies from person to person. In addition, some vaccines will cause adverse effects. Some of the more common ones include pain, swelling, or redness at the injection site, rash, fever, fatigue, headache, body aches, and fainting. While rare, there is also a risk of a severe allergic reaction to a vaccine. With that being said, what we do know is that vaccines provide at least some protection from infection and transmission in everyone, but what they are really good at is protecting children from serious illness and death.
Thank you for your participation and engagement. Please fill out the post survey so that we can achieve an accurate measurement for our research.